I congratulate all of you for taking the time over your lunch to learn more about egg freezing. I think, feel like as women, so much of our health education is focused on not getting pregnant, and there's just not as much focus as there should be on understanding the normal age-related changes that do happen in terms of egg number and egg quality. And egg freezing becoming a more mainstream option is really a revolutionary thing in terms of giving women choices to have a little bit more options over their reproductive future. So it's fine to have video on, video off, whatever you're most comfortable with. And I'm going to start going through our PowerPoint here. So we're talking today about egg freezing, which is a new life of possibilities, very fancy title, but something that's definitely been more in the media over the last decade. You know, egg freezing in the beginning was an experimental process. We have decades of research with freezing sperm and freezing embryos, but traditionally eggs were hard to freeze because they have a higher water content and you just didn't get very good survival rates. And so usually people were only freezing eggs if they were in a cancer diagnosis where there was no partner and there was no time to choose a sperm donor, and it was kind of the only option, and it was seen as a less good option than creating and freezing embryos. But with the development of this technique called vitrification, which is basically a way of flash freezing the eggs, all of a sudden eggs do quite well. And I'll show you some data. And that ability to freeze eggs has really allowed the field to just explode and become a much more mainstream option. It's been featured in many articles over the years. I know there have been a lot of celebrities on reality TV that have talked about egg freezing, especially athletes, because then you're talking about a career that is really physically demanding and really short window of time that often does overlap with your reproductive years. And so if you want to watch more of an experience for someone just kind of talking you through what it feels like to go through egg freezing, we have some videos on our website from the Storm Sue Bird as well as Brianna Stewart talking about their experience freezing their eggs at SRM. And they're quick little videos, but I definitely encourage you to think about watching them if you just want to see what it's like to go through the process. And these are just a couple quotes from that series that Sue talked about the fact that this isn't weird. It isn't something that should be whispered about, that this really should be a normal conversation for all women that have careers or career oriented or have goals. And I think it's been really interesting for me working during this pandemic, seeing the increase that I've had in people wanting to freeze eggs, because I think there is something about maybe being at home and the stress of this scenario really makes people reflect on their life and their long-term goals. And for a lot of people, that does include eventually building a family. And if you're not in the position to know exactly when you're going to want that to happen, your ovaries are still aging. And so thinking about egg freezing just gives you options in the future that you might not have otherwise. Brianna talked about the fact that pregnancy can put a huge pause button on things, and freezing eggs for her was the logical choice to want to have a family later. The stress of your ovaries being a ticking time clock is there, and this for her helped to eliminate the stress. So what we're going to talk about today is kind of an overview at a pretty high level about why you might want to freeze your eggs, what's involved in the process, what would happen next if you want to actually learn more about your specific egg supply. And that's probably the most important thing that I'd want you to get from the talk today, is that everybody's egg supply is different. And so when I'm talking about data and statistics, all we're doing is using population level data. But two women who are both 34 might have very different egg supplies, and there's no way of knowing your particular egg supply without doing testing. You can be super healthy, you can take really great care of yourself, and you may still have a lower than average supply of eggs for your age. And that doesn't mean you can't get pregnant, but it does suggest that for all of us, there's this decline, and some people that fertility window is going to be a little bit shorter than others. And so the only way to really know for yourself what it looks like your egg supply is to do some testing. And we'll talk about what you would do next if you were interested in learning more about the specifics of your ovaries. And then, of course, as I said, I'll have Annika talking about how much it costs. So let's start with kind of a fertility 101, the basics of fertility and aging. And they are unfortunately a little depressing. Again, I've been working here a long time. And so over that time, now I'm 42. Now I'm clearly in this advanced maternal age category that you hear about. And so I don't want anyone to feel like this is something that should be shaming or, it is a biological reality that although men continue to produce sperm throughout their lifespan, and there are some decreases in sperm number, counts, and quality as they get older, it's much more subtle versus for women, you are born with all the eggs you're ever going to have. And that supply does start to drop off fairly steeply, especially once you get into your mid-30s. So we've known this for decades of historical research. If you look at some of the older data, they would typically use age at marriage as a marker for fertility. Obviously, that's not the case anymore, but that is part of the reason that some women do pursue egg freezing, is that in an ideal scenario, they want to parent with somebody. And if they're not yet in a relationship with someone, there's always lots of good options for single parenting, and we'll certainly mention those a little bit at the end. But a lot of people in an ideal scenario want to wait and have a family until they can share that experience with somebody. And so traditionally, we found that those that waited and got married in the later ages, 30s, especially mid-30s, and especially over 40, tended to have a much lower chance of achieving a pregnancy within that relationship. And that's primarily because, again, you're born with all the eggs you're ever going to have. And every single month of your life, your ovaries are bringing to the surface your kind of egg allowance for that month. And I'll show you some diagrams and some pictures. And even if you're on hormonal birth control, so you're not actually developing and ovulating an egg every month, your ovaries are still bringing your chances of eggs to the surface, and you're still losing eggs. So even if you've been on the pill or have an IUD and you don't actually get periods anymore, your body is still churning through its egg supply. And we see that that number of eggs goes down. Primarily, again, it's a curve that goes down gradually, but it gets a lot steeper after age 35. And that's why we talk so much about freezing eggs for people that are in sort of the early to late 30s. So this is just a diagram that kind of represents if we were to look at your ovaries, and I'll show you some actual ultrasound images of what it looks like when we look at your ovaries. This is imagining that we squished your two ovaries together to be one ovary. And when we look under the ultrasound, we can actually count these little circles. They're called follicles. And each little circle of fluid has an egg that has been brought to the surface for that month to potentially be the one that grows and ovulates. And that supply still represents just a fraction of the tens of thousands of eggs you still have left in your body. So when we're counting the follicles, we're not counting the eggs your body has left. Your body has many, many more eggs than that. But we're counting the ones that have been brought to the surface for that month, because those are the only ones that are available to us to try and grow, mature, and potentially freeze. So when you're 30, your ovaries typically are bringing between 5 to 10, sometimes even 15 follicles to the surface each month. And that's because you probably have about 50,000 eggs left in your ovaries. So your ovaries send in the whole bunch of recruits, and then only one follicle grows. So as one egg matures and matures, or if you're on birth control, no eggs grow. But typically, one will grow and grow, and then that big circle of fluid bursts open, that egg comes out. That's what ovulation is. That egg could potentially get fertilized and cause a pregnancy or not. But all of those other little ones that didn't grow, they just shrivel up and go away. And their body isn't picking the good versus the bad eggs. It's very random which of those follicles actually grows and develops. But that means that every month you're losing maybe, 10 to 20 eggs, even though you're only actually ovulating one. All those other potential recruits also shrivel up and go away. And then you have a new batch the next cycle. And so by the time you're now 35, your supply has dropped almost in half. So now maybe you only have about 24,000 eggs left in your ovaries. And by the time you're 40, often you're down to only 10,000 eggs remaining. And so again, that's still a lot. People can still get pregnant, certainly, but your ovaries get more stingy. And so as you get older and there are less overall eggs remaining, fewer are brought to the surface to grow. And that means that you have kind of a smaller pool of eggs that we're picking from in any given month, or that your body's picking from. But the main reason that it gets harder to get pregnant is that not only are these egg numbers going down, but this entire time, those eggs have been in your body. So those eggs are sitting there, they are exposed to the world, exposed to toxins, and the actual DNA inside the egg doesn't do as well. I'll show you a slide next for what I mean about that. But your chance of having that one egg that is randomly selected to grow and ovulate being what we would call a normal egg versus an abnormal egg goes down dramatically. So when you're 30, again, you still have some eggs that are not going to develop normally. Certainly even women in their 20s have miscarriages. But by the time you hit your mid 30s, you see how this ratio of normal to abnormal is now about even odds. And then by the time you're 40, now the majority of eggs are no longer chromosomally normal. And so your body is picking, maybe one egg from 10 instead of one egg from 30, and maybe only 2 of those 10 eggs are good as opposed to 27 of 30 eggs. So you can see how statistically your chances of having an ongoing healthy pregnancy have gone down dramatically by the time you're 40 compared to the time that you're 30. And this talks about what I mean when I talk about quality and chromosomal abnormalities. So if you think back to kind of middle school, high school biology and what's involved in that process of meiosis when egg and sperm meet up, the actual chromosomes inside the egg line up in the middle of that cell. And then when that cell combines with the sperm cell, that's when the chromosomes from both partners have to cross over and form that new embryo, which is now a combination of the chromosomes from egg and sperm. And so younger eggs, people in their 20s, you see how these little chromosomes line up really nicely in the middle of the cell. Versus by the time an egg is now someone who's 40, especially as you get into the mid 40s, these chromosomes are kind of all over. They don't line up as well. And because of that, when you have that process of crossing over with egg and sperm, there's a much more common chance that the new embryo that is created from the egg and sperm meeting is going to have either a missing or an extra chromosome, because that crossover is more likely to be abnormal. And that's what we call an aneuploid embryo. That means that it has either extra or missing DNA. And the reason that you hear about things like Down syndrome having a higher chance when women conceive at older ages is because that's one of the very few times that an embryo could have an extra chromosome and still be compatible with a live birth. Most of the time, that embryo has extra or missing chromosomes and it's just incompatible with life. So that's a pregnancy that will just never actually happen. Either the embryo will not even be able to implant, or it will end in an early miscarriage. So the chances of making an aneuploid embryo by the time someone is 43, 44 is about 90% chance, which I know is really depressing. And what we see is that that's still a limiting factor, even with fertility treatments. So I know it's been in the media, you see all these women having children when they're in their 40s, sometimes even in their 50s. And what they're not talking about is that most women that conceive with fertility treatment after the mid 40s are using the eggs of a younger woman, of an egg donor. So this is just showing you statistics from IVF cycles. And you can see how people that are trying to do IVF with their own eggs, by the time you're in your mid 40s, the chances of success are single digits, about 2% chance. Versus those that are using eggs from someone who is in their 20s still, that's when you get to those 50% or better success rates. So I think sometimes there's this perception that because fertility treatment is so much more available and people have the options to do IVF, that age doesn't matter anymore. And that's unfortunately not the case if the goal is to have a child using your own genetics, which for most people is kind of the ideal scenario, although again, there are many, many ways to build a family. And sometimes people come in and are interested in learning about egg freezing. And once they find out more about the specifics and the cost, some people feel like it's not a good fit and they're open to the idea of potentially using an egg donor instead. But it's for most people nice to at least have that conversation about your specific scenario as well as your goals and what you value. And again, I know this is a lot of stuff, so questions about any of this, please do put them into the chat bar. I'm going to hope that it makes a little bit more sense as we go through more now with the specifics. So there are many reasons that people choose to freeze their eggs. The most common is that people are just not ready to start a family right now. And that can be for a variety of reasons. A lot of people are career focused. They're doing this because they know that this is a current time where they're really focused. We have a lot of people that are potentially in long medical residency programs, things where they just know that this is not the time in their life that they're able to devote the energy and time to parenting the that they want to, but they also know that there's still that biological reality. A lot of people, the reason they're not ready is, as I mentioned, that they don't yet have a partner and they are hoping to wait and try and have children when they can share that experience with somebody. Sometimes people are ready to have a pregnancy right now, but they're also aware of that impact of aging and they want to freeze eggs before they even get pregnant to increase the likelihood of having another pregnancy in the future. I feel like this is something that people don't always consider when they're freezing eggs, but especially as more companies offer this as a benefit. I've definitely had people coming in who are maybe 35, 36, and they are planning to get pregnant in the next year, but ideally they want to have 2 or 3 kids. And that thought is, well, even if I get pregnant on my own for this first child, there's pregnancy, which is going to take you a while. A lot of people are going to want to breastfeed, and that might add another 6 months to a year after delivery. And now maybe you're coming back at 38 or 39 for baby number 2, and it may or may not happen as easily. So because your egg number and egg quality only goes down with time, being able to preserve what you have right now does give you additional options in the future should you need to use them. And I'm tossing around eggs freezing as what we're talking about today, but those that are already partnered, there's also the option to create and freeze embryos instead. And I don't want to make this talk too confusing, but just know that when people come in and are interested in learning more about any sort of option that's what we would call fertility preservation, that's always something that we're going to talk about, what makes the most sense for your specific scenario. So the main consideration is the fact that we hope you don't need to use your frozen eggs. People are doing this because they want to have options for the future, but the majority of people are hopefully going to conceive on their own and not need to come back and do treatment. And of those that do, there is not a guarantee that you're going to have success with frozen eggs. That's the other hard part, is that there is not a way to test the genetic quality of an egg. Again, we're talking about how those chromosomes line up in the middle, but what really makes an embryo that is going to be normal or abnormal is once egg and sperm combine. So there's not a way to test the egg itself for quality without just destroying it, because you need to know what happens when the egg and sperm meet up. And so sometimes people can freeze what seems like a good, reasonable number of eggs, but then if they come back in the future to use them, we might find out that that quality is lower than expected and they may not conceive. So we never want people to feel like because they froze their eggs, the pressure is completely off. They don't have to think about it. They know that they've got those there when they need them. It's giving you options that you wouldn't otherwise have, but we never want people to make life decisions on the assumption that this is going to be for sure their family building plan. So I see some questions coming in, which is great, about age ranges and when to get pregnant, as well as technology. So I'll definitely address those, but let me go through a little bit more the process that's involved here. So what do we do when we freeze eggs? The first step is, again, to talk about your specific circumstance. So we would have you do, because of COVID, a video call with one of our nurse practitioners, and we'd have you fill out a profile all about your personal medical health history. And we just talk about your situation, what your goals are for the future, whether egg freezing does seem like it's a good fit. And then you come in for some testing so we can get an idea about your specific egg supply. So we do that by checking a blood hormone called an AMH level. We'll talk a little bit more about that. And we do an ultrasound to look at the ovaries and actually count those little follicles that we see. And then we do a follow-up, also a video visit, to then review your specific results, talk about what the expectations might be if you decide to freeze eggs, and then make our plan. The actual process itself is fairly simple. You are giving yourself injections because in a normal cycle, remember, your body has brought that whole allowance of eggs to the surface, but naturally only one typically grows. So to freeze eggs, we have you give yourself hormone injections that cause, hopefully, a good percentage of that cohort that's on the surface of the ovary to grow together. And so those do involve injections. They're primarily injections in the abdomen, so they're very tiny needles, but you do sometimes get a little bit of bruising. And because your body is hopefully growing multiple eggs, often you will have increased bloating, sometimes some extra PMSy symptoms in terms of all that extra estrogen your body's producing. Some people can feel that they're a little bit more hormonal. Some people get some headaches, some hot flashes, but we're really talking about a short window of time, typically between 10 and 12 days of these injections. The only day you typically have to be off of work is the day of the egg retrieval. I'll show you a picture that talks about what's involved with that. And then your eggs are frozen. So we don't see an issue so far in terms of the data, in terms of how long the eggs are frozen relative to quality. And again, we have lots and lots of data for sperm and embryos, but now also for eggs, that once they're frozen, your success rates should be the same, whether you're using them 2 years from now or if you come back 5-10 years from now. So this just shows you a little bit what I'm talking about when we do an ultrasound. So we do vaginal ultrasounds because that's how we're best going to get a look at the ovaries. Ovaries are very small. So you feel a little pressure from that probe, but it only goes in a tiny way. And we look at the ovary and we count these circles of follicles, and we use how much fluid we see in a follicle as a marker for when we think that that little microscopic egg inside is ready. And that's why when you come in for visits during an egg freeze cycle, we're always going to both look at the ovaries and we're going to do a blood draw to check your estrogen level. As those little eggs grow, the cells around them pump out fluid. That's what we can see on ultrasound. We never see the actual eggs. Those are microscopic, but we can see how much fluid surrounds them, and we use it as a marker for maturity. And then we also see how fast your body's estrogen level is rising, and we use that to adjust the medication dosing up or down to try and get just a nice group of eggs to grow together. We're not trying to slam your ovaries and get, the highest possible number of eggs, because that's not actually thought to be all that great for the quality. So we're trying to get a nice group to grow together. And usually you're coming in for ultrasounds and blood draws about every 2 to 3 days in the beginning. So when I'm talking about 10 to 12 days of doing shots, you're not coming in for 12 visits. Usually you're coming in for about 3 visits, although sometimes if your cycle goes a little bit longer, we do have you come in a couple days in a row at the end, because we want to make sure that we're triggering for the egg retrieval procedure at whatever day we think we're going to get the max number of mature eggs. So the egg retrieval process itself is considered a minor surgery. There's no external incisions. Basically, we use a vaginal ultrasound, just like what we've been doing to look at your ovaries throughout the cycle. But now there's a tiny little needle attached to the end of the ultrasound. And with that needle, we can poke through the walls of the vagina and we can drain the fluid and then handle those tubes of fluid over to the embryology lab, who can now look under the microscope to actually find those microscopic eggs and then freeze them. So there's no incisions, but there are going to be a few of those little puncture marks. And so because we are having a small needle poking through the walls, we do have you have anesthesia just for comfort. And so we know that you're not going to move or do anything that might cause us to not have optimal positioning. So the time that you're actually asleep for the egg retrieval is usually only about 20 minutes. But because it's going to be an anesthesia process, you do plan to be in our Seattle office for about 2 to 3 hours. We have you get there early so that we can review everything again. We do start an IV to be able to give you that medicine. And then again, you're asleep for about 15-20 minutes. And then when you wake up, we have you stay for about 45 minutes afterwards to make sure that you're feeling fine and able to go home. You would need somebody to be your ride home on the day of the egg retrieval. Because of the anesthesia, you're not allowed to drive yourself afterwards, and we're not allowed to just release you to an Uber. We want you to have somebody there with you to make sure that you're doing okay after. The vast majority of people are going to feel just fine afterwards, just a little sore, a little bloated, but we do want you to have somebody who's there just to make sure you don't have any complications. And we would talk about all this in much more detail, what to watch for, but there's always a physician who's on call. And if after you go home you do have concerns, we'd be, talking about what to do next. But the risks of complications from an egg retrieval are extremely rare. So I'll go ahead and kind of wrap up with the presentation, and then I'll start going through these questions on the chat bar, because I do see a lot of good questions going in. Those people that at the end of this talk want to learn more about what's involved in the process, you basically have two options. A lot of people, if they feel like, yeah, there's a pretty good chance I do want to freeze my eggs, or at least learn more about it, what you would do is schedule for a new patient visit, which is an hour-long video visit, again, typically with one of our nurse practitioners. You can see anybody in the offices right now. And that's where we really talk in specifics about your history, kind of your goals, and then move forward with that process for testing. Some people after this talk are like, well, that's interesting. I know there's nothing that I can do at the next year or two right now, either because of age or finances, but I'm just curious what my egg supply is. And so for those visits, we also offer a really short visit called a fertility assessment call. And basically that is just a blood draw to check your AMH level. So AMH is a hormone that's related to egg supply. It's kind of released by cells on the ovaries, and the higher your AMH is, the higher number of eggs you might be able to retrieve in an egg freeze cycle. What AMH is not is a hormone that predicts pregnancy chances, okay? It's all just about egg quality, and what it most correlates with is the number of eggs that can be stimulated and retrieved in a cycle for either egg freezing or traditional IVF. So checking an AMH level just kind of gives an idea of, if you did decide to freeze eggs, ballpark, how many eggs do we think you could get in a cycle? And often that gives people some information to kind of redefine their fertility goals. So it just gives a broad prediction of eggs from a retrieval. And again, that's important because it varies per individual. So many people are going to get anywhere from 5 to 20 eggs each cycle. Ideally, a lot of women are aiming to get about 20 eggs or more, which again, some people will get in one cycle. Many people do more than one cycle though to get to that number. And the chances of success with those frozen eggs are very, very dependent on age. So I'll finish the talk, and then there's always questions on this. What are my success rates for me at this age? So I'll pull up another handout before we're done to show you a little bit more about that. But the number that you get can completely vary by individual, and that's why we want to do some testing for you. So let me turn it over to Annika to talk a little bit more about the cost aspect.
Hi, everybody. I'm one of the financial counselors here, and so one of the most common questions is just about the prices to get started. And with a new patient consultation, as well as the AMH blood draw and the ultrasound, those are usually billable to most insurances. A lot of insurance policies offer at least diagnostic coverage, and that's what those services are. Preliminary testing. So if you don't have insurance and you are completely self-pay, these are some of the prices you can expect. With a new patient consult, it can go up to $300. It is time dependent, and so the provider would price out their time according to the length of the conversation as well as the complexity of the discussion, but up to $300 on that one. And then an AMH blood draw is $69 out of pocket, and an AFC, antral follicle count ultrasound, is $175. And then a follow-up consultation to talk about your results and moving forward, that's usually between $175 to $225. So again, all of those are usually billable to most insurance companies if you have an active policy, but that would be the out-of-pocket prices. I see a couple questions about codes. We are happy to provide diagnosis codes, CPT codes. CPT codes are easier to provide, where you can just take the code associated with the service and call your insurance to ask if it's a covered benefit or not. Diagnosis codes are a little bit more tricky, especially for a financial counselor, because we aren't the ones determining that. That's the provider. And a lot of times the provider don't determine the diagnosis codes until the actual time of service. As far as cost for treatment, an egg-free cycle out of pocket, which a lot of times it is completely out of pocket because most insurance companies see it as elective and they just don't pay for it, unfortunately. The retrieval, which is the monitoring visits that Anne mentioned, the ultrasounds and blood draws, the retrieval under anesthesia, and then us freezing the eggs, that is a flat fee of $8,250. And a lot of times the retrieval will have medications involved that range between 2,500 to 5,500, and that totally depends on what your body will need, and your provider would determine that medicated protocol for you. So if you're looking at on the high end, you're probably right around like $13,000 or so if you need the high end of the medications. And then a monthly storage fee to keep those eggs frozen, you got to pay rent on that, is $55 a month. So $55 a month for as long as you like. And we also have long-term storage that we could discuss with you that is at a lower interest or lower rate if you want to have your eggs transported and stored for 5+ years.
And someone asked about limits. So right now we've set a limit on people using their eggs of age 52 because that's statistically the natural age of menopause. So if you do freeze eggs, you would have to make some decision about either use, discard, or shipping to long-term storage if you don't use them by that time frame. But again, that's pretty rare. The vast majority of people who freeze eggs are going to make a decision one way or the other well before that time. And then someone asked a question about if eggs are transported, if you relocate, damage, loss. So, we are here, our laboratory is where it is on Lake Union. And that's because of that, when you're doing your cycle, most of these visits for the ultrasounds, blood draws can be at whatever location is the closest for you. So we have Kirkland, Bellevue, Tacoma, up in Everett, obviously Seattle, or Spokane. And so a lot of those visits will be whichever office is the easiest for you. But the actual day of the egg retrieval will always be in our Lake Union, except for our Spokane patients. They do have their own lab in Spokane. And then the eggs are frozen there because we want it to just be eggs come out of your body. They go through the window. They're exactly where they need to be in the embryology lab. And then if in terms of eggs going somewhere else, that would be up to you if you decided to ship them to an offsite facility. Usually we do recommend just keeping them here because most people are going to know within that 5-ish years whether they need to use the eggs or don't. Again, the hope is a lot of people conceive naturally and then they feel like their family building plans are complete and then they decide to discard those eggs. Every time you ship the eggs somewhere else, there is that tiny chance of something going wrong in the shipping and storing process. And so often it makes sense to not do that unless you know that you need to move the eggs somewhere. And so obviously people relocate. And so sometimes people freeze their eggs here and then they might move somewhere else until they're ready to potentially use those eggs. Usually you wouldn't have the eggs follow you. You would just leave them stored where they are. And then if you realize that you are going to need to try and use those eggs, then based on where you are, you can make a decision for whether it makes sense to just fly back here to have the actual embryo transfer versus having the eggs shipped out to you. And there are pros, cons. A lot of it really just depends on where you end up. If you settle somewhere that is a major metropolitan area, has great fertility clinics, a lot of people might choose to ship their eggs versus if you're somewhere a little more rural, eggs are still a little tricky. So ideally for the best success rates, you want them thawed in a lab that has a lot of experience with both freezing and thawing eggs. And so that's why some people do choose to come back here for treatment if they need to use those eggs in the future. I think we're mostly done. Let me see. Oh yeah, so we've kind of covered a little bit about this. Why would you want to freeze eggs with us? Again, we are the largest practice in the area, and that's really what you want. You want a laboratory that is doing a lot of this because you want that quality control of it just being part of their routine process, what we do in terms of using those eggs. We've been freezing eggs since 2004. And we really want to take this collaborative approach to patient care. We know that there are many, many ways to build a family. And again, some people do a consult thinking they want to freeze eggs and then might find out that they're not a good candidate for egg freezing. Maybe their egg supply is a lot lower than expected. And it doesn't mean they couldn't freeze eggs, but once they take all things into consideration, I've definitely had some people that feel like, you know what, actually, maybe I do want to just try and get pregnant now. Maybe I'll do an insemination with donor sperm and kind of go that path. So we really want to talk about what makes the most sense for you. And we try to do that personalized care because we are so large by being able to, again, partner with you wherever you are. So again, with the COVID precautions, it's actually been kind of nice to be able to do these video visits with people who are maybe not as close in physical location to the clinic. So when you decide to come see us, you can look on our website to see bios about all the providers, and you can choose from any of our physicians or from the nurse practitioners. Usually the nurse practitioners do handle the egg-free cycles because the whole point is you're not an infertility patient. Most people have not tried to conceive yet. The process of freezing eggs is much simpler than a full-blown IVF cycle, and we'll talk a little bit more about what I mean by that. And so usually it's going to be a pretty straightforward process, but some people feel more comfortable seeing one of the physicians from the beginning, and that's totally fine too. We do everything as a care model. So everything the nurse practitioners are doing and talking about is in combination with all the protocols that we've already discussed and arranged with our physician team. So let me go on to our questions because we've got lots of good questions here. So I'm going to try and kind of bundle things together. Let's see. There definitely are questions about success rates, which we always have, and what are my chances of being able to have a baby with frozen eggs. So let me pull up a handout here. And Annika, while I'm doing that, can you talk a little bit about, there was a cost here about in payment plans. You can talk a little bit more about those financing options we have.
Of course. Yeah. So unfortunately with treatment services like the $8,250 for the cycle and the medications, there's not a payment plan option for that. We do require full payment prior to cycle coordination. So your financial counselor that you will get assigned to when you establish care with us, they can walk you through preferred lenders that we work with, financing options. We can lay out a lot of good things to kind of do homework on and look into for finding the funds for this because it is a lot of money. And so on our end, we do collect the $8,250 before we can give the clinical team the green light to start securing dates and get you on the calendar for an actual retrieval. And with medications, we work with third-party vendors, so you're actually paying a pharmacy directly for those. So unfortunately, no payment plans on that. But if you wind up doing some of the preliminary testing and we bill an insurance company and they, for some reason, deny like the new patient consult or the ultrasound, something like that, some of those services we can work with you on a small payment plan, but just not with the treatment. And then I also kind of wanted to touch on the cost, the potential cost for transporting tissue. If you did freeze with SRM and you wanted to transport your eggs off to a different clinic, we do have a handling fee that we charge on our end, which is $200. You would likely also have third-party shipping fees. And then your new clinic would likely have a receiving fee. So there are some costs in that you would want to consider at that time as well.
Let me share my screen to show you a different handout on egg supply. Does everybody see the pictures again with the little circles? Okay, so this shows you a little bit about the chance of pregnancy with using frozen eggs, and here's where you really see that impact of age, and that's why we always want to have a conversation with you specifically once we've done some testing and have an idea about how many eggs we think we might be able to get per cycle, because you can see how chances of success go down with age. And so someone that comes in to freeze eggs in that sort of 30 to 34 window, even if they only freeze 5 to 10 eggs, is going to have about a 50% chance of pregnancy if they need to use those eggs down the road, versus someone that comes in at 41, even if they froze 30 eggs, would only have a 45% chance of getting pregnant, because even though they froze more eggs, statistically that quality is likely to be lower. And so we always want people to get to a number that they feel good about, but it's important to see that no number gets you to 100%. So again, it's giving you options, but we never want people to feel like it's a guarantee. Most people are trying to aim for somewhere in this 15 to 20 egg option, because that's what gets you, in general, success rates of above 50%, even at age 38 to 40. And especially at some of those lower ages, you can get to as high as a 75% chance of pregnancy. And someone asked in one of the questions about, let me get back to my chat box here, about success rates and as they get older and healthy pregnancy. You know, the main limiting factor for a lot of women as they get older is that egg quality issue. Women that are postmenopause can have beautiful uteruses that form healthy pregnancies with hormone support. So if you're overall healthy, those that are coming back and wanting to use these eggs in their potentially late 40s or 50, we just have you have a visit with one of the maternal medicine specialists first to make sure that overall you're healthy enough. But most people are going to not have an increased risk of complications because of the age alone. It's the egg and then embryo quality factor that's usually the main thing that makes it harder as you get older. Some of the other good questions, this comes up a lot. Someone was asking about, am I still going to be able to make eggs later? So yes, when you're freezing eggs, what we're doing is growing that month's egg supply. Those are eggs that your body would have lost anyway. So we are not making your body run out of eggs any faster than they normally would have. It's basically just saying that month, instead of ovulating one and the other 20 dying, maybe we can get 18 to grow and freeze them instead for future use. Someone else asked about whether there's damage to the ovary from the egg retrieval. So the risks of complications from the egg retrieval are very low, kind of a less than a 1 in 1,000 chance, but it is a surgery. So we are poking a little needle, and that's part of the reason that we definitely have warning signs that we want you to talk about. And that's also one of the reasons that I do think if you're going to freeze eggs, you want to go to a clinic that has a lot of experience with it, because you want people that every day are doing multiple egg retrievals. You want that skill set nice and high to keep that chance of a complication as low as possible. We give you antibiotics in your IV to keep that chance of infection low. So we talk about more of the specifics of this, but the chances of having complications, especially those that would decrease your future fertility, are very low. Let's see, someone else was asking about whether you have to be off of hormones. So to get the body to respond and to grow the eggs, if you have an IUD in place, either a copper, a Mirena, a Skylar, that's a really low level of hormones. They primarily act in the uterus. We don't see a lot of systemic effects. You can leave that in place. So usually you're not having to come off of that. The only issue is those that have the implants. Those release higher levels, and often the body won't grow the eggs as well. So we don't recommend freezing eggs if you have like a Norplant. People that are on like Depo-Provera shots, some forms of hormonal birth control do make it harder to grow the follicles, but IUDs do not. And if you're taking hormonal birth control, stay on it for now. Often we actually put people on birth control pills for a couple weeks before they start the egg-free cycle, because it keeps your ovaries kind of calm and quiet. It's stopping your body from already growing one egg for the month, so that when we start those injections, we're already ready to go. So you would have to briefly go off of birth control pills during those couple weeks that you're on the injections. And we go over all this in more detail, but definitely that's one of the main things that we talk about with people, is that when they're in this egg-free cycle, we don't want anyone to have an unintended pregnancy. So we do recommend that you abstain from intercourse from that time you start the injections until the time you get your period, which is usually about a week after the egg retrieval, because our goal is to retrieve all those eggs, but it's possible that there could be something that comes out a little later, and we don't want someone getting pregnant who doesn't intend to. Someone else had a good question about, if I don't get enough eggs after a cycle, do I have to pay for multiple cycles? Yes. That's the hard part, is that we can make our best guess for how we think your body is going to respond based on your testing, but we never really know until we're into the cycle. And so a lot of people, especially if we know from the testing that they're probably going to have slightly lower egg numbers, do plan even from the beginning that they might want to do 2 or even 3 cycles. Or sometimes people are hoping for just 1, but then that number retrieved is unfortunately lower. And so, Annika, I think there is a discount for multiple cycles, right?
There is not with egg freezing though. It's more geared towards patients that are going through embryo creation and either not obtaining embryos to move forward with a transfer, or they transfer the 1 or 2 that they get and they're unsuccessful. So there's a discount for attempting multiple embryo creation cycles. With egg-free cycles, it is $8,250 each time you attempt. So if you wind up doing multiple cycles, you would just have to factor that cost in. I also noticed a few questions about like interest rates on loans. That's kind of hard to tell you. Like our two preferred lenders that we work with, they will only go as low as 9%, which can be a little steep for a lot of people. So your financial counselor would walk you through, like I said, a lot of different options, doing a loan through your private bank, refinance loans through your house. There's all kinds of stuff out there to help you find this money to be able to go through. We do not accept care credit. Unfortunately, that is not something that we will take on. So there are a lot of different um, employers that will offer egg freezing. A lot of insurance companies don't offer it, but there are more and more that are picking it up. And it was on one of Anne's slides. So it's a lot of tech companies like Amazon and Microsoft, Uber has it. I think Pinterest might have it. It's a company called Progeny. So if you ever have an employer and you're going through the benefits and you see one that says Progeny, there's a good chance that you might have elective egg freezing that's a covered benefit. So that's just a good little buzzword, Progeny.
And I know we're getting close to the end. I want to try and get the last couple questions in. We had a couple questions about kind of quality control process backups. I know some of you probably saw in the news a couple years ago, there were two big generator failures in fertility clinics, one in California, one in Ohio, where a lot of frozen eggs and embryos were lost. And I think that was definitely a good reminder for all clinics that you need to have backup systems, which we have. We have kind of above industry standards in terms of the backup generators, people on call. We definitely obviously see these eggs and embryos and sperm as being extremely valuable. But just like there's no guarantee, should the Cascadia quake like flatten Seattle, there is always the potential for lost material. And that's why we never want people to feel like literally all your eggs are in one basket and this is the only thing that you do. But the chances of something going wrong are extremely low, and we certainly take that very seriously and want to follow everything and beyond that we can to decrease the chances of some sort of accident happening. I also had a good question about COVID. So there are crazy myths online about the COVID vaccine and fertility. No, there's not a reason to delay doing this after vaccination. The recommendation now for women that are pregnant is they're now in that category for getting the vaccine, and there's not an issue with you getting the vaccine relative to egg freezing cycle. Some people do experience some side effects with the vaccine. So, if you decide to maybe not want to do that right in the middle, just so you're not dealing with multiple side effects of hormones as well as that. But we don't recommend that you need to delay vaccination in terms of the cycle. But we do COVID testing before the egg retrieval. So we only can do egg retrievals knowing that COVID risk is low, because this is considered an elective surgery. And so all of our patients who are going to have an egg retrieval around day 9 or day 10 of injections, once we know you're getting really close to the time, we will be doing a COVID test. And if it came back positive, your cycle would be canceled. And so all of us should be following all of these guidelines in terms of social distancing. You have to do a pre-screening form before you come in each visit to the clinic, showing us you don't have any symptoms. But some people, just to be extra safe, choose to, on their own, go to one of these local testing sites and get tested even before they start the cycle, just to ensure that you're not that asymptomatic person who is going to have a positive test. And again, that would be another reason to think about, if you have the option to get vaccinated, getting vaccinated first as well, just to keep that chance really low of having your cycle be canceled should you come back positive. Let's see. Lindsay, do you know, I've had a few questions about whether there's going to be a copy of this presentation. I think in the past we've sometimes emailed out the PDF.
Yeah, so we can send out the PowerPoint, but since it's being recorded, we can also send out the recording too.
Okay. And again, there's definitely a lot of questions coming in about specifics. That's the whole point of having that visit, is that two people at 34, at 38 are going to have very different egg numbers. And so really, we want you to get some testing done so we have an idea of your specific egg supply, and then we can have a much better conversation about expectations, goals, and success. I think that's kind of the end. I'm sorry I didn't get to every single question, but I think we definitely hit the main ones. And again, there's always a ton of questions about cost and finance. That's why we have our great financial counselors, and even two people that have what seem like the same Primera insurance plans can have vastly different benefits. So that's why we want you to work with one of our counselors to kind of better understand specifically what's covered for you, if anything.